This is the Lone Crater YouTube. We hope this video helps.
You begin by verifying identity, name, DOB, MRN, so chart integrity is maintained. Once confirmed, open Epic and go directly to the clinic schedule or ED track board for the appointment slot. This brings up the patient context. Select the patient row and click Check-in or Arrive to start the check-in workflow. This first action populates demographic and appointment data, which saves time later and prevents duplicate charts. So make sure the appointment status updates to arrived before proceeding. Once check-in opens, you complete intake fields that drive care. Update demographics and insurance to prevent billing delays, then confirm emergency contact and language. Next, capture vitals and enter allergies, active meds, and the problem list so clinicians have accurate context. You should also document consent, reason for visit, and any pre-visit questionnaires. If the patient signed paper forms, scan or upload them into the Media tab. These steps ensure clinical teams receive reliable, billable information when the encounter routes forward. You finalize by confirming visit type and assigning the primary provider so orders flow correctly. Then set the encounter status to roomed or in process so the team can start care. Reconcile any standing orders, print or send after-visit instructions, and document payments or financial flags. If something goes wrong, like status not updating, duplicate appointments, or the check-in pane freezing, first refresh the patient context. Check for locked scheduling conflicts and restart the check-in module. Escalate to IT if the problem persists.
Thanks for watching. Consider subscribing if we helped you.